Hi, this is Dr. Pamela Langendorfer.
And this is Dr. Jerry Bailey.
Welcome to Lakeside Holistic Health.
As we work with you, as you've seen before, we're going to look through your timeline history to figure out what's going on in your history to see where things went wrong and how we can correct them. We're going to use some functional labs, as we've noted in the last few videos, to help develop your life plan. That's what this video is about your life plan itself. We're going to look at diet itself and really recommend some appropriate ways to eat for you to have a balanced nutritional regime throughout the day, so you're feeding yourself throughout the day. We're going to look at using acupuncture, both myself and Dr. Pamela, chiropractic from myself potentially, supplements within there. We use high quality ones. We'll talk about those in this video, some exercise that we may have to do, and then definitely if we need to do a prescription, we can do that from there. Your life plan itself, we recommend quite a few different diets, but one of the main ones we recommend is kind of a modified Paleolithic type diet or a low carb. This type of diet really is a whole food based diet. A lot of vegetables, small amounts of fruits, good lean meats, wild caught preferred or organic or grass fed, and really eating a really nutritionally dense but calorically poor diet. That's going to help feed your system, and we'll go over through that quite a bit in the visit with you, and then we'll probably have you have a little video series to watch on that also, to making sure you get all your questions answered. We also may include acupuncture. Now myself, Dr. Bailey, and Dr. Pamela both do acupuncture here in the clinic, and depending on the schedule here and your schedule, you may see one of us, either or, to help you with some acupuncture. Chiropractic itself, that may be included in your plan a couple times a week for 3 to 4 weeks or longer, just like acupuncture, to make sure your body's structurally sound and functioning the way it's supposed to. We may include supplements within there, and again, supplements aren't going to cure your issue, but they're going to help supplement your diet, and that's how we use them, to get that balance occurring as quickly as possible, and then ideally weaning you off of them and get you on some base ones just to support your everyday life. We may do some hormone replacement therapy with there, and Dr. Pamela manages those patients with the hormone replacement therapy, and we may include some exercise to get you moving once we get you to a point in your health, in your life plan, to allow you to do those things. Exercise is very important. We're animals and humans that are based on movement, and we need movement in our life to make sure the joints are lubricated, the discs are lubricated within the spine, and our body and joints can move the way they're supposed to. And again, we may also use a prescription item if need be to help get your health back in your life.
Acupuncture has been around for over 4,000 years. And a lot of times when people come in, they're very nervous about having acupuncture because the first thing I hear is that I'm afraid of needles. Is it going to hurt? The needles that we use are very small, fine needles, and they're very bendable, almost like a hair. Most people don't feel much when they go in, or they feel a little bit of a poke and then it's gone after that. Some of the other tools that are used during an acupuncture session, one of them is moxa, also known as moxibustion. This is an herb called mugwort, and we use a smokeless moxa, so it doesn't get quite as smoky in here, but it does have a distinct smell to it. So if you come in the clinic and you're wondering what that smell is, it's usually that we have been using moxibustion, and that's often used for people that have pain, chronic low immunity, or a lot of fatigue issues. Cupping is something that is used also quite a bit. These are some glass jars, and in the future we will have some videos on some of these individual things so you can see them, what they look like. But I use cupping often, usually typically on people's backs. We're using it for pain. You can also use it for any type of tight muscles, asthma, and these cups can leave some pretty dark marks on people. I often tell them it might look like you've gotten beaten, sometimes by an octopus, because they're large, round, dark marks. But this is an indicator of how much tightness is usually going on in that area. And as we do more cupping, you'll get to a point where you won't have any marks at all. Acupuncture is also very relaxing, and it can help to restore balance back in the body.
Chiropractic itself is what I do in the clinic. Dr. Pamela doesn't do chiropractic adjusting, but chiropractic believes that there's innate health potential. It's controlled by the nervous system, and the nervous system controls everything going on in the body. If there's irritation to the nerves, it will lower function of some sort. It may lower immunity. It may increase pain. It may cause numbness or tingling in the arms or legs if there's irritation in those nerve roots. And what we're trying to do is remove those irritations by adjusting the joints, either in the spine, neck, mid-back, or low back, in the pelvis itself, in the elbows, in the wrists, fingers, and the hips, the knees, ankles, or toes. If there's a joint in the body, we can do it. Even the jaw itself. A lot of patients come in with what's called TMJ, and that's we work on that also. And like I said, it's not just the spine. We work all over the body. Part of the tenets of chiropractic is information comes from top down and inside out, and that's how we balance the body. We get the nervous system functioning optimally, so that way it can heal. And it works on all ages, and we welcome all ages to the clinic. I've worked on newborns, my kids included, on up to elderly. I think my oldest patient I've adjusted is about 97 years old, and she loves to be adjusted. She's a hoot. So it's for all ages, and we really help to balance the body through adjusting the spine itself. When we're adjusting the spine, we're also working on acupuncture points there. So that's a really cool aspect of chiropractic, is there's several meridians that run along the spine. As we adjust those segments in the spine, we're also affecting acupuncture points.
One of the other things that we use often here are supplements, and we're going to talk about this in a separate video, and I'll go into detail about what good quality supplements are and the reason why we use the ones that we do.
Once again, you can join our Platinum Wellness Club via online through Facebook or our website. You can see us on YouTube, Twitter, Pinterest, or Instagram. We want to thank you again. This is Dr. Jerry Bailey
and Dr. Pamela Langendorfer.